Welcome to Locally Sourced. I'm Armanda Famiglietti. If someone you know or yourself needs assistance with mental health issues or substance abuse, you're not alone. The Putnam Family and Community Services Agency has been helping your neighbors for over 20 years, and today I'm very happy to be joined by two of their dedicated staff members. Alison Carroll, who is the Vice President of Strategic Initiatives, and Diane Lotto, who's the Team Leader for Senior Partnership Services. Thanks very much for being here.
Thank you.
Thank you.
Before we start, I just want to tell you something about our guests. Alison Carroll has over 30 years of experience as a social worker and administrator working in outpatient mental health programs with children and adults with behavioral health conditions. She believes in recovery and providing services in a dignified, person-centered manner. She is currently the Vice President of Strategic Initiatives of Putnam Family and Community Services, and she's won several large grants for the agency in recent months. She has served as board member of the New York State Care Management Coalition, is a current member and past president of the New York Association of Psychiatric Rehabilitation Services Board, and is a frequent presenter and trainer at conferences. Since 1999, Ms. Carroll has been an adjunct professor in social work program at Mercy College. She has a bachelor's degree from SUNY Binghamton and a master's degree in social work from New York University. Ms. Carroll was awarded the New York State Office of Mental Health 2002 Achievement Award for Excellence in Service. And Diane Lotto worked in the mental health field since 2010 before pursuing a master's degree in social work at Fordham University. She became a licensed social worker in 2014 and joined the Putnam Family and Community Services Agency in January of 2017. Thanks so much for both of you being on the show today.
Thank you for having us.
So, Alison, I'm going to start with you. And for those of us, myself included, who aren't that familiar with the services of PFCS, can you tell us about the agency?
Sure. We address mental health needs, substance use, social and emotional issues of individuals, family, children, seniors, anyone in the community who deals with these issues. Our staff is very committed to fostering hope and wellness and recovery, and doing so in a dignified manner. We do believe that any and everyone has the capacity and ability to recover, and it's just a matter of getting help and, again, having the hope from people who are working with you. And contrary to popular belief, Putnam Family doesn't just serve Putnam County. We actually, anyone who can get to our doors, we will serve. So we do see people from northern Westchester, from southern Dutchess, even from Connecticut. So it is larger than just the county itself.
That's great. So I understand that you're celebrating your 20th anniversary. Congratulations. How has the agency evolved over 20 years?
Well, this was actually a very unique situation. Putnam Family was the first agency in New York State to actually privatize its services. We used to be a county agency under Putnam County, and in 1997 they decided that it was costing too much money and it wasn't going to be as beneficial to run the services under a county format. And the staff of the agency actually formed together and created a board and privatized the agency. So there were many studies done on this because it was the first of its kind in the state. And we were begun under that culture and that premise, that, again, belief in recovery, which unfortunately wasn't exactly the belief at the time in mental health treatment, especially substance use, a little more so, but not mental health. So it was the belief that people, no matter what diagnosis they came in with, can recover. We started with, I think, around 50 or so staff that we had shrunk to after the privatization, and we now are at just about 100, between 90 and 100 staff.
Yeah, 100 staff members.
Over 20 programs, so we've grown immensely.
Are you running out of room?
We are absolutely running out of room. We just moved into another building right up the road next to the other two buildings. We're renting and hoping to
because I noticed you had like 2 addresses.
Yes, and now 3. There's never enough room.
Oh, okay. Well,
never enough room.
So it sounds like you do a lot and you help a lot of people. And as I mentioned before, mental health services and substance abuse. Can you just kind of fill that picture in and tell us about the program?
Sure. So in mental health, again, we serve children through seniors. Not a lot of agencies serving children in the area. And we have a mental health clinic, mental health services, which is where probably the average person in Putnam would come if they want treatment. And we see people there with relationship issues, marital problems, depression, stress, anxiety, phobias, all the way through to, whatever diagnosis.
Yeah, I think we have a graphic actually of a puzzle that sort of explains the different pieces that fit together. Oh, there it is.
Yes. So that would be our mental health counseling and treatment. And our alcohol and substance use services and prevention, again, is for people. We have a lot of people who have been arrested for DWIs, but anyone who feels that they are struggling with use of substances, and again, that is drugs, illegal and legal. We are seeing, of course, a huge opioid crisis in the county at this point, as through all over the state. So we have those services. In addition, we have prevention services in 3 of the local schools, and that is to teach children from elementary school through high school about substance use and build character, so maybe they will not choose to start using substances. The other graphic was community-based services, and Diane will talk a little bit more about one of her programs under that, but that would be our care management programs, where we work with people in the community who need help to link to services, need help getting benefit programs, treatment, whatever it is that they need. So it's not the treatment itself, but actually linkage. And then the last program is our rehab services. And that is our PROS, which stands for Personalized Recovery Oriented Services. And that's a program for people who have more serious mental health diagnoses and illnesses. And they can go there, and it's kind of like going to college. They would pick groups or classes that would help them to succeed in the barriers to them being more productive and leading happier lives. We also have vocational services there where they can help get jobs for them and develop jobs, get back to school. We've had someone who went recently and finished her master's degree in social work through that, through our help. We also have treatment, so if they need to have the actual individualized treatment and medication. So it's a program that's a little more intense than a clinic, which might be a once-a-week appointment. This could be anywhere up to 5 days a week, up to 5 groups a day, depending on what a person needed. And then we have just lots of different little programs, advocacy programs, parenting programs. We have a visitation program for children who've been removed and are in foster care, and the parents are looking to get back their parental rights. So we are the place where they can come and visit with the child, supervised visitation. So we're doing that with the Department of Social Services. We have peer specialists in the agency, and that is people who have lived experience of mental illness or mental health issues themselves and have recovered to a point where now they can give back. So we know that it's very helpful to have someone say, I've been there and I get it. Sometimes it means more than just a clinician trying to work with someone. So it's kind of a partnership of all of these services, and we'll pump in to someone whatever it is that they need and want. They are truly a partner with us. So we don't always know better, and that's the key to remember.
That, I am amazed at what a full-service agency you have over there. That's tremendous. So tell me a little bit about how it relates to our community. You mentioned substance abuse and the opioid crisis. Now, are those programs that have grown over the years because of the demand? Can you talk more about that?
All of our programs are grown. When we first began, we were not seeing children in the county, and so we began seeing children, and that has grown hugely. Sadly, we have seen children as young as 3 who come in with suicidal ideation, who are thinking of or wanting to kill themselves. So the child program has grown. The opioid epidemic, we have just begun treating with different medications for that. So that has grown, and we've just added in the last year, I think, about 25 or 30 people to our role. So that has grown enormously. But why it's important to the community, because I believe that we all have a stake in making sure that people around us are as healthy emotionally and socially as possible. And when people are doing well and they're happy, they're more productive citizens. They make better parents. They make better friends. They make better neighbors. So whether it's you or someone else who is needing treatment, it helps everyone if people are functioning to the best of their capacity.
So you mentioned working with children, very young children, and families as well. So you can talk a little bit more specifically how you target the families and who in the family are you helping? Is it a holistic kind of approach for families?
Everything is holistic, but you can't treat a child without treating the family. First, for just the purposes of legal issues, but also because a child's issues are always directly related to what's going on with the family as well. So we would have the family involved. It's always a little more difficult when you have a teenager and how much the teenager wants the family to know and not know, and we have to tread that carefully. But you would always want to get a family, even with adults, because people who have those supports, who have families who are willing to be involved, or we can re-engage, have a much better chance of success of recovery than people who are isolated and not with people. So we do our best to involve not just family. Family is a loosely defined term. For some, the family might mean their neighbors, their best friends, who might be closer to them or are healthier in a place where they can help them more. So we ask the client we're working with to define who is their family and then try to engage them. And we do have people who say, I don't want anyone involved, and we have to respect that as well.
I think that's one of the best things that I've seen in working at Putnam Family is that we don't necessarily just focus on the person in the small snapshot that you see from them when you might see them for 1 hour a week. We really work to involve all of their organic supports in the community, their friends, their family members, their neighbors, their other doctors and other treatment providers that we can work with to really make sure that we're addressing the whole person and not just this one small picture of depression or anxiety or stress management issues. We're able to work all of those things in together and also target them.
Thank you for adding that, because the informal supports are so critical. Funds dry up and therapists and programs change, but an informal support, so maybe it might be your priest or your rabbi who you can help engage someone with, and the person might stop coming to Putnam Family, hopefully, because our hope is that everyone will not need us. It's to put ourselves out of a job. We aren't here to keep,
as most nonprofits should do, right?
But that they could retain those informal supports in the community, and that's why it's so important to engage them, as Diane said, so that when we pull out, there's still that network there for people.
So do you bring them all in at the same time, or how? I mean, if you're talking about a little micro community really that surrounds the person who's having the issues, how do you reach out to all the members of that community?
Well, first I would start with the client and defining what it is that are their needs and what they want, what they're comfortable with. Some people will say, again, I want my mother but not my father. And then you would bring in people. You might have one group family meeting where you have a bunch of people and you kind of get to see the dynamics. But I mean, most of the work is still with the individual, it's helping the individual. You can't make a family change. The person has to come in and want to change themselves.
Well, you talked a little bit before about preventive services. So can you talk about that? How is that an outreach effort, or?
So that is in right now 3 of the schools in Putnam. We have it in Garrison, Putnam Valley, and Mahopac. And it
elementary and
elementary through middle school. We have a special program in Putnam Valley in the high school, which if we have time we can talk about as well. But that involves having a prevention worker in those classroom situations, and they actually have curriculum-based programs that they provide in the classroom that teach kids things about drugs. And again, you're not going to teach a kindergartner about drugs, but it might be teaching a kindergartner about socially, what you're doing and how you present yourself, and building up that character so they would have the strength to maybe refuse the drugs in later grades.
So it's mostly centered about preventing drug abuse.
It's prevention.
Or drug use.
There is always mental health
Alcohol
involved.
use.
It's a program that was funded and based on substance use, but you can't separate mental health and substance use because people often have both of them. It's not necessarily just one or the other.
So I assume, even though you seem to be able to do everything, do you partner with other agencies or the municipality? You used to be part of municipality.
Yes, and people still think we are. We absolutely partner. We have contracts with Department of Social Services, I mentioned earlier, and we attend meetings. We actually started a Putnam Collaborative with all of the mental health, substance use, social type agencies in the county that we meet every 2 months or so to make sure we all know what each other are doing, because sometimes the best answer is in your own backyard and you don't know it's there, and we don't provide it but someone else does. So we definitely partner. We call up each other. We provide referrals back and forth. The beauty of living in Putnam is that it is so small. You can learn all the resources pretty quickly. And people by name, so you can call up and actually get the commissioner on the phone and not just a secretary. So a lot of partnership, a lot of collaboration goes on in Putnam.
It's a terrific community in Putnam County. actually, talking about Putnam County, we have lots of local press, and in one of those local press papers, I read that your agency received a substantial grant, and when I saw that, my eyes popped. So can you tell us something about that grant and how you got it and who it came from?
I will. That was my pride and joy. $1 million grant that we are one of 8 agencies in the entire state that got.
Fantastic.
And that's rare because Putnam is so small. We don't always have the numbers and the statistics to compete with some of the larger cities. So when we got that grant and I got the word, I was screaming and called up our executive director. She was screaming. And it's something that we wrote because Putnam does have the largest amount of seniors per capita in the state and has one of the fastest growing populations of seniors. So I really played that up in the grant. And there's a lot of seniors, because of the geographic nature of our county, that are isolated and can't get out. So we wrote this grant that would address trying to do outreach in people's homes and help them. But I'm going to turn it over to Diane, because then we hired Diane to run the program.
Right. So Diane, you're the team leader for Putnam Family Community Services Senior Partnerships Services.
Yes.
And so tell us more about that. This is what you got the grant for.
So this is what Alison got the grant for.
Can I just ask one more question?
So
who awarded the grant?
It was the Office of Mental Health.
The New York State Department?
Yes,
Office of Mental Health?
Yes. So the grant and the program is designed to reach out to seniors or older adults, people 55 and older, who are in their homes and are struggling with mental health issues, struggling with substance use issues, and maybe are not able to access treatment for whatever reason, be it that somebody is maybe too ill, just had surgery, is not able to get to a clinic. They could be homebound. They could not have transportation or the means to pay for transportation to get in and out of a conventional treatment setting. So what we do is our team is mobile and we're able to go out to the home, meet with the person, do intake, and offer all of the services that we would offer in a setting like Putnam Family Community Services in their home. So myself being the social worker on the team, I would be doing the talk therapy and working with the clients in that way. Our team also has a care manager. We also have a peer recovery coach. We are hiring a nurse, and we have a psychiatrist who consults on our cases. So we really have a very wide range of services that we're able to offer to people in their homes. And because we're grant funded, we also do not bill their insurance. So all of our services are free. And so we are able to help people get access to other insurance policies. If they don't have insurance, that's something that our care manager would be able to help with. And because of the population that we are working with, it's really important for us to make sure that we're talking with the other treatment providers that are seeing our clients. So if we have somebody who's very medically ill also, to really be able to collaborate with them and make sure that we're taking care of all of the needs that they have and keeping that in mind when we're working with them on mental health and substance use issues. The program was also written as a partnership between 2 other agencies, so it's a triple partnership. We're working with the Office for Senior Resources in Putnam County and the National Council on Alcohol and Other Drug Dependencies. So all together, our agencies are working together to be able to coordinate these services, make sure that if somebody needs, maybe more case management kind of services, we're able to, direct them to the Office for Senior Resources, or, be able to fill out the applications and get them going in the direction that they need to go in. So it's really a fantastic program to be a part of and to be able to bring these really desperately needed services to people.
That's terrific. You mentioned earlier that your service is not just in Putnam County, it's anyone who can come to your door. Is that true for this as well? If I lived in Pauling or Patterson,
unfortunately, no. Because it's a grant, it is more limited to Putnam County. So in order to be eligible for our program, people have to be 55 or older, a resident of Putnam County, and struggling with any mental health or substance use concern. Doesn't necessarily need to be a diagnosis. We don't need paperwork and all of that kind of stuff to back that up, but really it's just...
So we have a graphic that is, this is, I guess, how you're publicizing the program. What's NCADD?
That's the National Council on Alcohol and Other Drug Dependencies.
Okay.
That's one of our
So those are
partnership
the three
agencies.
partners for this grant. Does this grant have a time limit? When is it going to run out?
Our grant is 5 years, and this is a grant that, has been done before.
5 years starting in 2017?
Yes. It's a grant that's been done before, but it's something that can definitely be continued. So it depends on, how we build it up and how we're able to reach out to people.
And we're hopeful that with all the changes in managed care and insurance companies, that we'll be able to actually self-sustain ourselves after the 5 years are over.
Oh, that's terrific. How does the healthcare debate at the national level affect you, or does it?
I don't think anyone knows yet.
Right, no
how
one
that's
knows.
It depends on what's going to happen
That was
with
an
the
unfair
ACA.
question. No
Oh
one
my gosh.
knows.
Yes, there's so much that's going to be dependent on. So, Putnam has a lot more people who now are eligible for Medicaid, and that has helped them to get services. If that changes, everything's up in the air.
Right, but you're a nonprofit, so you do raise money, right? You get grants from the state. Do you get grants from foundations?
We do, but our main amount of funding still comes through Medicaid and the private insurances, which don't pay so well.
So fee for services.
But fee for service and Medicaid and some Medicare. So if people lose their Medicaid, we do have a sliding fee, but it's not enough to keep us going if we had everyone on sliding fee. So it's always a nice balance that we try to maintain.
So I'm not sure I have this right, but Medicaid was expanded in New York as part of the Affordable Health Care Act, right? Obamacare. And that was something that was proposed to be rolled back in the fail healthcare bill. Are you worried that that's going to come back again?
Absolutely.
Okay.
Absolutely. It would impact New York horribly. Yeah. Horribly. From the governor down, they've said how this would be detrimental to New York and to people.
So the expansion of Medicaid actually has been able to help you serve more clients?
Yes, to have more people be able to afford to come for services.
Okay, that's good to know. So there's something coming up pretty soon. It's a really fun activity, speaking of raising funds for the agency. And can you talk to us more about this special event that's all a buzz in the community?
Yes, we have a spelling bee, and it is amazing fun. I think it's one of those events that whether people know who we are or not, they want to come to because it's just fun. And it's a group spelling bee, so no one is spelling independently and getting embarrassed when they mess up a word.
Right.
You spell with a team.
Yes, so we have a graphic up that's, I guess, your poster for the 8th annual Spelling Bee. I guess it's pretty successful if you're running it for 8 years in a row. And we also have some photos of some of the happy people. Now, are these the winners from last year?
I believe so.
That's a huge trophy.
That's our executive director in the middle. You have to you have the trophy for a year, and then you pass it over to the next team, kind of like the Stanley Cup. Whoever wins the next year gets the trophy.
So it has to be huge because you have to write all the winners' names on it.
The team names, yes.
And here are some enthusiastic participants.
People dress up. They come with their team names and T-shirts and cheerleaders, and we have lawyers and doctors from Putnam Hospital and a little bit of everyone, librarians.
That's the Lawyers Club, right? Did they come every year, the
they
lady lawyers?
Do. The lawyers are a tough crew. They come every year. Yeah, so it's the 27th of April and at the Star Ridge Banquet Center, and we hope to see people there. It's not too late to sign up with the
There
team.
is, and I was going to say, are there still tickets available?
Yes.
So quick, let's get those tickets sold.
Absolutely.
And is there a cash prize besides that beautiful trophy?
Just the fame and fortune of winning.
Just the personal satisfaction of knowing you're helping a great agency do great work, and that you can spell.
And it's only $30 a person, and that includes a buffet dinner.
Oh,
so really,
a buffet dinner, is that before or after the?
Right before.
Okay.
And then we go right into the spelling bee.
So they're spelling on a full stomach. That's probably
cookies,
good.
Cookies, all kinds of fun things.
So you have such a great program and such a great agency. I'm sure people watching are going to say, how do I find out more about Putnam Family Community Services? So can you give us some, can they reach you?
Sure. Well, first they can call the agency and ask to speak to anyone in the agency for more information. We have a website which people can go to, which I think is going to be shown on the board, but it's www.pfcs.org.
There it is. I see it.
And
your phone number.
You can follow us on Twitter, which I am not familiar with at all because I don't understand Twitter yet, but Facebook, you can follow us on Facebook. Come to our events. If you come to our events, generally support us, but you learn more about us.
Right.
And
Do
have
people
fun.
come back over and over to the spelling because it looks like so
Absolutely.
much fun that they can't wait?
There's probably a core member of the same teams that come every year and compete.
Well, they have something to prove,
and it
right?
gets cutthroat at the end.
Yeah,
Yes.
I can imagine.
Yes.
So you know what? Time's up. Can you believe it? I just want to thank you two very much for coming, appearing on the show, taking the time out of the day. Jackie was terrific, who helped put the show together with me, and she was great. I really appreciate it. I'm sorry she has the flu today. But Diane, I want to thank you for the work you do.
Yes,
and
thank you for having us.
Allison, I want to thank you for the work
Thank
you
you.
do, and all the rest of the people at your organization. And I want to thank the terrific, hardworking volunteer crew here at Comcast Channel 8. Till next time.